My name's Anthony Tucker. I've been with Coastal Ear, Nose, and Throat since 2012 after I finished my Navy career. We were founded in 1998 by Dr. Meunier and Dr. Morante, so we've been in the area almost 30 years. We're a small practice with 5 partners now. Everyone that's joined our practice has stuck around until they retire. So we're very proud of that, and we're very proud to be in the community for as long as we have been. In 2024, due to some practice management issues in ENT in general, we joined Elevate. ENT specialty, a lot of problems are starting to arise with overhead costs, insurance, Medicare reimbursements, as well as a MIPS situation where you're having to meet all your MIPS to keep your Medicare reimbursements correctly. Procedures, those costs get higher and higher almost every year. Insurance costs, it's hard to negotiate. I'm not a businessman, so negotiating with an insurance over and over again, and that's difficult. And when there's, 5 partners, you don't have a lot of pull. And we started interviewing lots of different, either private equity-backed firms or just MSOs in general, looking to see what we liked and what we didn't like. It took time to find the right fit. Someone that can help us negotiate with insurances, someone that can negotiate cost of goods, and then also to help us hire physicians. And that's something that Elevate was able to help us bridge that gap. I believe prior to Elevate, we interviewed 6 4th and 5th year residents, and their request for a starting salary was over $200,000 to $300,000 more than we were paying ourselves in salary. Elevate was able to help bridge that gap, the insurance gaps, and so far we've been doing well with negotiating price of goods. If you're a small practice or a young practice or even an older practice that's looking to partner with an MSO, the main things you need to ask them are you going to impact my schedules? Are you going to ask me to see 50 patients a day if I'm comfortable with 35? Or are you going to tell me that I need to do more balloons in the office if I'm not comfortable doing balloons at all in the office? Are you going to impact my patient care? I think that's first and foremost. And then number 2 is how are you going to impact my staff? Because staff is part of your practice. And then probably third is how are they going to decrease your overhead? Because every MSO that you're going to partner with, there's going to be a give and take. You're going to pay some management fee, and that's just the way it is. You need to see how are they going to help you cover that management fee. And with Elevate, we've, in just the year, seen that we've made up a large portion of that management fee, percentage-wise, every month. Those are kind of the 3 main points when you go to any MSO, whether it's a professional management organization ran by a private equity firm or a physician kind of practice managed by just the same physicians, say ENTs, or whether it's a multi-specialty MSO. Ask them those specific questions and get the answers that you're looking for.